Cognitive development in infancy is best understood through Piaget's stages of cognitive development. We will discuss this in more detail in the next slide. Other important aspects of cognitive development include information processing theory and language development. Information processing theory explains how individuals take in, process, store, and retrieve information. In infancy and childhood, cognitive development is seen as a gradual improvement in attention, memory, and problem-solving skills. Social workers use this theory to understand how experiences shape learning and to develop interventions that enhance cognitive skills, especially in children who have experienced trauma or neglect. Language development refers to how children acquire and refine their ability to communicate. It begins with early sounds and gestures, progresses to single words, and later forms complex sentences. Social workers play a key role in identifying language delays and advocating for early interventions to support communication skills in children. When one mentions cognitive development, one thinks of Piaget's stages of cognitive development. It is important to know the different stages and what is encompassed within each. While Piaget's model is presented in its entirety on this slide, it is important to only focus on the part applicable in infancy, which is the sensory motor stage that occurs from birth to 2 years of age. This is when infants learn through sensory experiences and motor actions, developing object permanence. There are 6 substages associated with Piaget's theory. However, only the first 4 are pertinent to infancy. In the reflex activity substage, infants use innate reflexes, like sucking and grasping, to interact with their environment. In the primary circular reactions substage, babies begin repeating pleasurable actions centered on their own body, such as thumb sucking. Secondary circular reactions substage is characterized by infants beginning to repeat actions that affect their environment, such as shaking a rattle. Lastly, in the coordination of secondary circular reactions substage, goal-directed behavior emerges, and infants combine actions to achieve objectives, showing early problem-solving skills. This is also when they begin to develop object permanence, or understanding that objects exist even when out of sight. Social workers should assess whether infants are meeting cognitive milestones, as early exposure to neglect or trauma can significantly hinder cognitive development. Delays in cognitive milestones, such as lack of object permanence or difficulty engaging with their environment, may indicate developmental disorders or environmental neglect. In some cases, social workers will also assume the educator role, teaching parents about age-appropriate activities that enhance brain development, such as reading, sensory play, and responsive interactions. Socio-emotional development refers to the process individuals go through to understand emotions, form relationships, and develop social skills. Infants rely on caregivers to form secure attachments, regulate emotions, and develop trust in their environment. Social workers assess socio-emotional development to identify issues such as attachment disorders, emotional dysregulation, or social difficulties, providing support through interventions like therapy, caregiver education, and community resources to foster healthy emotional and social growth. In this presentation, we will focus specifically on Erik Erikson's stages of psychosocial development and attachment theory, which was developed by John Bowlby and Mary Ainsworth. Erik Erikson's stages of psychosocial development outline 8 stages that span across the human lifespan, with each being marked by some psychological conflict. Successfully resolving these conflicts ultimately leads to health development, while failure can result in emotional challenges. The 8 stages are outlined on this slide, although the second stage should say shame and doubt rather than guilt. Regarding infancy, we are specifically concerned with the first stage, trust versus mistrust. In this stage, infants learn to trust their caregivers and environment if their needs are consistently met. Failure to meet needs results in mistrust. The last concept we are going to discuss is attachment. Attachment theory outlines 4 styles of attachment, which shape an infant's ability to form relationships later in life. These 4 attachment types include secure attachment, avoidant attachment, ambivalent attachment, and disorganized attachment. The text also describes the 4 stages of attachment: pre-attachment, attachment in making, clear-cut attachment, and reciprocal relationships. Social workers, especially child welfare workers, must assess attachment patterns when determining whether an infant's environment is stable and secure. Social workers can also connect families with resources, such as parenting education programs, like attachment and behavioral catch-up,